Thank you all for joining us for the SICSS-Africa and African Descendants Inaugural Panel, Interrogating Data Collection Methods Focused on African and African Descendants, Challenges and Opportunities. This panel represents our first foray into planning across 4 SICSS sites: SICSS-West Central Africa and Cameroon, SICSS-Covenant in Nigeria, SICSS-JIAS IPATC in South Africa, and SICSS-Howard Mathematica in the United States. It is my pleasure to introduce my student, colleague, and friend, Susanna Ejong, who will introduce this groundbreaking multi-site SICSS panel. First, her bio. Susanna Ejong is a global development, humanitarian, and peace and security consultant with over 15 years of experience in multilateral civil society and government organizations on 3 continents. She is co-founder of Collateral Benefits, a storytelling platform that documents perspectives from Africans and Afro-descendants about transcending COVID-19, a founding member of African diaspora platforms such as Afro-Innova, Colombia, and Africa 2.0, Spain, and a member of the advisory board of the Collective for the Renewal of Africa, Senegal. From Equatorial Guinea and Spain, Susanna studied at the Complutense University in Madrid, the School of Oriental and African Studies in London, is a 2014 Yale World Fellow and a 2022 Harvard MPA Mason Fellow. It is my honor to introduce Susanna.
Thank you so much, Nanette. It's so amazing to be here today with you and everyone around the room to talk about this important issue. The title of this panel is Interrogating Data Collection Methods Focused on African and Afro-Descendants, Challenges and Opportunities. And it's so relevant today. We all want to find solutions to the problems of today and the problems of the future. And for that, data must be reliable and of high quality. The reality is that there are a lot of problems with data. The data validity of problems pose significant bottlenecks for creating the right theoretical insights into the complex issues that are peculiar to the people of Africa and the people of the African diaspora. Previous attempts at circumventing data challenges in Africa have relied on surveys, estimates, or models that often do not reflect the reality of many African countries and communities. In order to have a robust discussion, we have to ask ourselves difficult questions. Questions such as, what challenges exist in the collection of precise data? How do these challenges affect how poverty indices and reports are generated? What can stakeholders do to improve data quality? What unique tools are available to collect more precise data that includes the perspectives of the communities studied? This panel will discuss these key challenges in the collection of precise data, as well as how these challenges influence how African and people of the African diaspora are studied and economic indices are generated. The panelists will draw from the unique expertise and experiences working with different forms of data to critically reflect and challenge current data collection methods while highlighting innovations and new strategies to collect data about people of African and African descent. Thank you.
Thank you all for joining us for our Africa and African Descendants panel discussion with Dr. Yahya Shaikh. My name is Nanette Coleman, and I am the organizer from the SICSS-Howard Mathematica site in the United States. It is my pleasure to introduce our speaker, Dr. Yahya Shaikh. I'll close with a few resources for you to get to know the 4 SICSS sites that organize this groundbreaking event: SICSS-West Central Africa in Cameroon, SICSS-Covenant in Nigeria, SICSS-JIAS IPAC in South Africa, and my site, SICSS-Howard Mathematica in the United States. Dr. Shaikh is a physician specializing in primary care and public health. His public health practice and training includes human rights and humanitarian assistance. His research has focused on the application of decolonizing methodologies and research. He previously served on a federal task force where he was focused on ensuring that the future of technology and health is equitably distributed. He is currently at MITRE, where he is helping shape participatory methodologies for research and policy development. Welcome, Yahya. The floor is yours.
Thank you so much. So I want to start off by saying Bismillah ar-Rahman ar-Rahim. I want to set a social and spatial and temporal context for what this conversation is going to be about. So spatially, I'm calling in from Baltimore. Baltimore is built on the ancestral homelands of the Piscataway and the Susquehannock people who had stewarded this land for generations. It's also built on, Baltimore City itself is also built on the backs of African Americans, Africans that were kidnapped and brought to America. Baltimore is interesting because way back in the days, this is a city where slave pens were built, and men and women chained together were marched through the streets from the slave pens onto ships that were waiting to take them into the final passage into bondage down in the South. So that kind of context is important because it gives an idea of where I'm calling in from. But temporally, there's another context as well. So we are having this conversation just a few weeks from the May 14th massacre that happened in on Jefferson Avenue in Buffalo in New York by white supremacists that walked into a marketplace. So we're just a few weeks removed from that. These temporal and spatial contexts are very critical to understanding the following conversation about FAIR. Because when we ask these questions, when we think about context, certain questions rise up. Some of these questions are around things like, why are we here? Where did we come from? How did we end up where we are? Where are we going? So these kind of questions, these are existential questions. When we ask ourselves as individuals, usually we are trying to grapple with the existential crisis, which we all should be, and we should be asking ourselves as individuals these particular questions: where we came from, how did we get here, where are we headed, etc. But when we ask these questions as communities, it leads to a very powerful questioning, a very powerful challenging of the assumptions that underlie the unequal distributions of power. So Hannah, can you go on to the next slide, please? So there's a couple of contexts that are relevant to FAIR. We mentioned this idea of unequal distribution and unequal distribution of power. So when we think about unequal distribution, like, what do we mean, right? So this is not an abstract concept. This is very much a reality. And this map is an example of that. So what this map shows is county level prevalence rates of diabetes. And the darker the red is, the higher the prevalence rate. The lighter the red or yellow is, the lower the rates of diabetes. So what we tend to see that the distribution of health status, chronic disease status, in this case diabetes, follows a certain pattern. It's not randomly distributed across the US, or else you'd see red kind of just distributed across, interspersed with yellow and orange. What we do see, though, is a series of contiguous counties that form clusters. And what are these clusters? So there's a couple of different very discrete clusters. So there's one near the top there, a cluster that cuts down Pennsylvania into Kentucky and a little bit into Tennessee. And folks might recognize this as the Appalachian Mountains coming down that Appalachian region. There's another cluster that cuts across the South and up the Mississippi River, starting from the Delta all the way up to the river. And this is one other cluster. When you take this southern Mississippi River cluster and the Appalachian cluster together, this is actually known in public health as, nowadays it's known as the diabetes belt. About 20 years ago, this was known as the stroke and heart disease or cardiovascular disease belt, because this is where the highest prevalence of strokes and heart disease were happening. About 90 to 100 years ago, this exact same place was known as the measles belt, because guess what? This is where the highest rates of measles would happen, right? So what are these clusters? Like, who lives here, right? So who lives here is, when you look at the Mississippi River Delta, this delta and the southern belt, this is where a lot of the emancipated African American, this is where slavery was the highest, and where after slavery, after emancipation, and we had Reconstruction, and then we had sharecropping that emerged during that period, that was an economic enslavement of the same group of people that were physically enslaved previously. And what that did is that economic enslavement leads to a maldistribution of resources. So those resources could be things like access to sufficient income to have shelter or basic necessities of life, like healthy foods, places where you can lead a healthy and thriving life. Well, because of that history, those particular maldistribution of resources, or what we call in public health social determinants of health, still exist. And because those still exist, those social determinants of health are precursors to health status, and therefore you end up seeing poorer health, elevated levels of diabetes prevalence. In fact, the Mississippi River contiguous series of counties that go along the Mississippi River, those counties are actually they have a mortality rate that's about twice as high as the mortality rate of other counties within those same 8 states. So it cuts across 8 states, and within those same 8 states, these particular counties have about twice as high a mortality rate and 4 times higher mortality rate than the rest of the US in general. These are the same places where you have a lot of other chronic conditions as well, not just diabetes. The Appalachian region up north, cutting across, Pennsylvania and into Kentucky and Tennessee, those group of counties also have a history of subjugation, but a different type of subjugation. They're mostly white, rural, and poor, and those are really subjugation around economic exploitation, extractive economies, where mining towns have been producing a lot of wealth, but not for the people living there, for folks that are corporations and others. You also have a series of counties that are kind of interspersed when you see interspersed across the US when you look at the Midwest and the West. So you see, for example, in Arizona and New Mexico, a series of red counties there. And then you look up a little bit north, you see a series of different counties as well. Those seem to be non-contiguous. They seem to be spread out. They're actually very much related to each other. These are the Native Nation reservations, indigenous communities that live in the US. And there they have a different set of factors that led to a maldistribution of resources, things like the long walk, the Trail of Tears, disenfranchisement from their land, and a number of other factors that shape current realities. So when we think about maldistribution, it's not just an abstract concept, it's actually something real that then leads to a maldistribution of health outcomes and how well of a life you can live and how long you can live that particular life. The other concept that we want to cover before we get into FAIR is this idea of challenging power, right? Because we mentioned that some of the questions around context leads to challenging the assumptions about unequal distributions of power, right? So we talk about unequal distribution, but power is a much more complicated concept. It's a multidimensional concept, and it has a number of different factors related to it, but one factor is this idea of interpretive lenses, right? Interpretive lens is basically who gets to define what reality is and who gets to interpret the reality of others, right? So what that means, what that looks like is, let me give you an example. I think it's an example that we can all relate to. So when we think about everybody in this session, we are basically literate from a Western educational perspective, right? We were considered literate. But when we take our framework of what literacy is, having the ability to read and write. But what that does is it orders our mental state in a certain way. Our conceptual schemas get some kind of a structure imposed on them. So by virtue of reading, for example, we read English from left to right, right? So when you take American students or Western students and we ask them to, for example, give them a series of pictures, and those series of pictures might be the development of a child, and there could be a toddler, and the toddler becomes an infant, and the infant becomes a child, the child becomes a young adolescent, and the adolescent becomes an adult, and then becomes a person who's elderly, and then there's passing away, right? So that temporal progression. When we ask folks with our background of Western literacy to arrange those pictures on a paper, right? So what they would do, and what most of us would normally do, is we would take the infant, put them on the left, and we take the person when they're dead, put them all the way on the right, and the progression, the temporal progression of a person's life would go from left to right. When we take that kind of a conceptual schema and we go to other countries, for example, countries that write from right to left, then we can understand why they do that. And when they are asked to order things in temporal order, they will order it from starting from the right going to the left. There are other communities though where you go to them and they're not literate in the Western tradition, and they're not literate in the way that we conceive of literacy, and then you ask them to order this. So what they will do is they will order it from left to right. For example, a toddler on the left, and then the person who has passed away on the right. They will order it in that direction. You ask them again tomorrow, they will order it in a different direction, starting from the right to the left, because there isn't this conceptual schema of reading from from one direction to another. So there isn't this consistency, or we would think. So when you dig a little bit deeper into some of these communities, one example is the indigenous communities, some indigenous communities in Australia, and we asked them this particular question of ordering temporally, this kind of temporal ordering does take place, where it shifts by the time of day, for example. Turns out though, it's not because they're not literate, it's because they peg time to how the passage of the sun is across the sky. So they're actually very much in tune and in a relationship with the cosmos and the environment. So if they're facing you and the sun is passing from one direction to the other, they will actually order in the way that the time actually progresses in the universe around us. So they will actually order it in one way if they're facing you, and they'll order it a different way when they're not facing you. And that's not because they don't understand literacy, but because they have a different concept of how time flows. And our concept of how we represent time is dependent on literacy in some way. So what this all means is that the idea of interpretive lenses, sometimes we, as folks who can understand what I just mentioned, because we have this literacy paradigm, then we tend to interpret other people's experiences through those lenses. And if we don't really understand their experience in the background, then we tend to write them off as, okay, they're illiterate, or they might be lacking in some way. But when you dig a little bit deeper, we understand the conceptual schemas are much more complicated than ours, and they have a understanding of the environment and relationship that's much further and more in depth than what we have, right? So that's one kind of interpretive lens that we have, that I think we can all understand. There's another kind of interpretive lens, though, that stems from subjugation. And this kind of interpretive lens, when I say subjugation, it's everything from colonization to enslavement and everything in between, right? And this kind of interpretive lens is really the power to interpret and represent and interpret what a group of people are. And one term for this is called othering. So othering is this idea of representing the other, the group that you're subjugating, with certain attributes and characteristics that are in contradistinction with who you want to be seen as. So for example, they are aliens, we are citizens. They are terrorists, and we are peace-loving people. They are unpredictable and violent, and we are predictable and not violent, we're peaceful, right? And these are all real representations that we do in order to shape our understanding of ourselves and to justify why those guys, those people out there on the margins, the other, are different, and we are not like them, we are the center, right? And one of the consequences of this is as an understanding of what power is once you are that center, right, then the linkage with power is that you have a different expectation of the system around you than the other population. So let me give you an example that just happened a few weeks ago. So most of us here, if you are African American, if you're young or male, you when you get pulled over by the police, you almost immediately have a stress response. You can't help it. You almost have a stress response, right? Your heart speeds up a little bit. You wonder what you should do to, you wonder whether you'll get out of the situation alive, right? There's always that chance that you might not, right? And these are not things that you're thinking about consciously, but because we read what's out there, we have family members that have experienced things, then all of a sudden there's certain schemas and concepts that are elicited, and then we get a stress response. It just happens. But there was another, let me just actually read something to you guys. This is a eyewitness account of what happened in Buffalo a few weeks ago. So this was on CNN, and this is an eyewitness saying about talking about the gunman. So he says the gunman came out. He put the gun to his own head, to his chin. Then he dropped it and took off his bulletproof vest. Then got on his hands and knees and put his hands behind his back. So this was the eyewitness describing it. And he says, I thought they were going to shoot him, the police. He thought the police were going to shoot him, but they didn't shoot him, right? So take that think about that for a second, of how the arrest happened there, and then think about the expectation that the gunman had. Because if you read the manifesto, what the gunman said is, this is literally what he said, because I'm reading it off the manifesto. He said, I should be stopped by police officers eventually in Emsley and then surrender to them. Or if I find another decent location the day of the attack, I'll head over there. And then he asks and answers a question himself in the manifesto. So he says, did you intend to survive the attack? So he says, yes, but the death was a definite possibility. These situations are chaotic and virtually impossible to control no matter the planning. Survival was a better alternative to death in order to further spread my ideals by media coverage and to deplete resources from the state by my own imprisonment. So this idea that a white supremacist can make that statement means that there's an expectation of the system that he has, that it will work for him in the way that he anticipates, right? And that is another dimension of power where you expect the system to work according to your own expectations, right? But the opposite side of that is the othered. This is the centered reality, but the reality of the other, the margins, the marginalized populations, is that there's another expectation that the system will not work for you. So Hannah, can you go on to the next slide, please? So all of this to say that when we apply this interpretive lenses to one population, then we see something different when it comes to research. So research, we tend to think as an objective enterprise. We tend to think of it as something that is hard data, it's cold data, there's no subjectivity, and the data is data, the numbers speak the truth, right? So that's not actually true, because what we tend to see is that who forms the questions, who's funding the research, who's doing the data collection, who's interpreting the results, all has an impact. So a really quick example is when way back in the days when I believe this was in 1986, when the federal mandatory minimum sentencing, the Drug Act was passed to do a mandatory minimum sentencing for different types of drug offenses. Because at that time, drug offenses and drug abuse was thought of as a criminal enterprise, right? And it was thought of it from a lens of criminality and criminal justice. And for that purpose, when this particular act was passed in '86, mandatory minimum sentencing was actually, for many policymakers, they thought we got to get tough on crime, tough on drug abuse. Well, what ended up happening is that there were two different types. There were many different types of drugs, but one really showed the disparity, and this was around the difference between powder cocaine and crack cocaine. So the minimum mandatory sentencing for crack cocaine was basically, if you had, I think, 5 grams of crack cocaine, then you would get minimum mandatory sentencing, versus 500 grams of powder cocaine that would lead to minimum mandatory sentencing. So what that means is that because a lot of white folks used powder and a lot of black folks, black communities were subject to crack cocaine, then it was easier to meet a 5-gram threshold than a ½ kilogram threshold, which means that that for the same drug, because the effect is pretty much the same. It's not the outcome of the crack versus powder that was the issue here. But when you look at crack versus powder, hitting a 5-gram threshold was much easier. So many more African Americans got prosecuted for it. And if they get prosecuted, many more African Americans got prosecuted compared to white Americans for powder cocaine. And then having gotten prosecuted, they had a higher likelihood of getting convicted. And then having getting convicted, they had a much higher, longer prison sentence than did the folks getting powder cocaine. So this kind of a disparity shows what happens when we think about drug abuse from a criminal justice perspective. Well, fast forward a few more years. Hannah, can you go with the next slide, please? And then we hit this idea of the opioid crisis. All of a sudden, the opioid crisis hits communities, rural America, suburban America, and folks that are making policies see their own communities being ravaged by this drug. Now, all of a sudden, it's still a drug. Cocaine is still a drug. Opiates are still a drug. But then all of a sudden now, the lens, when the lens is looking in the mirror and you're interpreting the image of yourself, then the interpretation becomes different. It's a public health crisis. For the first time, Vivek Murthy, under President Obama's administration, called this an urgent health crisis facing America. He called it the opioid epidemic, right? And that, all of a sudden, when you call it an urgent health crisis, a different set of resources come into play. It's not about criminal justice anymore. It's about interventions. It's about making naloxone available. It's about training people to recognize it. It's about being tolerant. It's about a whole set of other factors that then shape our approach and interventions and mobilize resources to address this particular issue, right? So now what this shows is that it's still a health crisis. It's still a very objective research question. Hannah, can you get on to the next slide, please? But then who asked the questions? Who funded the research coming down from Congress and NIH? Who collected the data? Who cleaned the data and did the analysis and interpreted the results and formulated the intervention based on those findings? All of that is shaped differently by the group of people who are doing that kind of, the funding and the interpretation, et cetera. So when we think about objective research is not actually that objective. Hannah, can you go ahead, please? One more slide. It's actually subjective to the lenses, interpretive lenses that individuals have when they approach a particular problem space. So what does this mean? Well, there's a lot of efforts now where people suggest that, well, what we need to do is diversify, right? And we need to diversify. But the diversification is not sufficient if we just bring in a diversity of people, right? Because the diversity of people, if they're trained in the same institutions and they're trained with the same interpretive lens, then even if they're looking at the same communities, their own communities, then the kind of interpretation that formulates out of that is subject to the interpretation of the centered and not the other, right? So what do we need to do? Well, we also need to diversify the how we do the interpretation, and the why and for the whom. Hannah, next slide, please. So what this means is the diversification of the how means that we have to think about what does questions like, Hannah, can you go to the next slide, please? Questions like, what does reality mean? So these are ontological assumptions. What is reality? What is truth, right? And then when we think about how, thank you, Hannah. When we think about how knowledge is, then how is knowledge created? What does it mean to know? How is it represented? How is it captured and disseminated, right? So the epistemology has to be taken into account, has to be different. The ontological assumptions have to be questioned, and the epistemological assumptions have to be questioned. And we need a different way of approaching these different spaces if we are to depart from a colonial mindset. So this is an example of how they might, so we covered this example before, but the point here that I'm making is that by giving these two examples is that it's not just the fact that we might not know the other if we are in the center, and we might not know the other even if we are in the margins, but we use the tools of the centered, we're not going to know the other. But that's not the only issue, but also the issue is that the other might have cognitive schemas. They might have mental schemas and conceptual representations that are so rich that we might actually lack it in the center. And we have to depart from the paradigms of the center to the margins in order to actually understand the margins the way they understand themselves. So Hannah, I'll go on to the next slide, please. So one aspect of this is this idea of what research paradigms we use. And this leads into the framework that we have constructed. So the research paradigms that are often times used are things like objective research, positivist, post-positivist paradigms, where reality, ontological assumptions about reality is that it's an objective reality that's out there and it exists independent of the observer, independent of the individual. And how knowledge is created is dependent on, quantitative methodologies and representation in numbers and those kind of methodologies. Well, there are pretty soon we start to realize, like, no, so the reality is subject to the person who's actually observing it, right? And so pretty soon we started getting paradigms that, like transformative paradigms, etc., that allowed certain methodologies like ethnographic methodologies, where you're able to embed yourself and observe the community that you're living in and represent that some way. But even there, with the ethnographic approach, the limitation is that it is true that it is more of a subjective approach to reality. However, the actual paradigm itself is still going through some kind of interpretive lens of the researcher who embeds themselves within a community. So there's a series of other paradigms, but for the sake of time, I'll get to the one that we utilize here. So this is the one called a post-colonial indigenous research paradigm. So here, the ontological assumption about reality is that reality is actually constructed through a set of relationships between the individual and their environment, the individual and the cosmos, the past and the present, the living and the non-living. And all of these, they come together and they shape what existence mean to a community and to the individual. And when you travel to different communities, whether it's within the US and the indigenous communities, or you go to most of the world outside of the Western world, whether it's Africa or Asia, or indigenous communities even in the Western hemisphere, in the European world, you tend to see this relational view of the universe that pervades their understanding of their worldview and their understanding of how existence really is. So we tend to take that into account. We also utilize not the embedding of a researcher within a community, but we recognize that communities have done research on themselves. They can represent and tell their own stories. We just have to ensure that there's a collaboration in exploring that particular space with them. And so what we tend to do is use what we call knowledge bearers or researchers that are within that community. And it could be elders within indigenous communities or councils in other communities, etc. We also explore systems surrounding the communities as being architected and designed for the outcomes they produce. What that means is whether you're a post-colonial society living in Africa or Asia, or if you are an indigenous community society here in the US, or populations that have been previously enslaved here, all of these, what they have in common is that there has been a machination and engineering of conditions in the past, a purposeful engineering to the advantage of one group of people and to at the expense and the disadvantage of the marginalized people, the enslaved or the colonized people. And that's not been a random occurrence, it's been consciously constructed. Because of that conscious construction, purposeful construction, it produced the results in the past that they saw, economies based on cotton, for example, right? So it did produce that, but then those same mechanisms still exist and persist to this age and shape the realities of the communities right now. And we can go into that a lot, but I'm not going to, because we are short in time, and I think I'm already over time. But one other aspect of this is that we situate contemporary realities within this historic and formative context of the community. Hannah, next slide, please. So what we do is we call this framework the fairness, agency, inclusion, and representation framework, because it takes it brings together communities in collaboration in exploring a particular space. But this is not completely unstructured, and it allows a certain collaborative exploration of a particular space. It doesn't have to be a question. It can be a exploration as well. So there are two major theories that underlie the structure that we use for this. When we say structure, what we're talking about is what are the interview questions that people will be discussing? What are the exploratory questions that people will be discussing together in a group setting or in a one-on-one setting, right? So those questions have to be grounded in theory somehow. They have to emerge from somewhere. So they emerge from two spaces. One space is actually work that Dr. David Williams and Dr. Selina Mohammed did at Harvard. You guys might be familiar with them already. They are pioneers in the work of racism and health and the connection between racism and health outcomes. So they've made that connection very extensively, and this particular figure here kind of summarizes a lot of their work and that conceptual model that connects it. What this framework does is it generalizes that model and applies it to communities more broadly, communities that have been colonized, discriminated against, etc. And race is not the only factor through which this kind of marginalization happens. There are many other ones as well, and we wanted to incorporate that. So we generalized this particular approach. And by the way, the paper that's coming out for this is co-authored by Dr. David Williams as well. The other perspective of this, so what you might recognize though, if we start down a series of questions that's founded on this particular framework, this particular conceptual model, it leads to a deficit framing of the community. But what you also want to recognize is that within the structures and systemic structures of marginalization that are imposed on a community, communities do thrive, they do survive, and they do have aspirations and many other richness that defines who they are to themselves, that might not be seen by others outside of that community, by the centered, for example. So in order to capture an asset framing of the community to represent themselves, there's another framework that we utilize from literature that uses, that looks at opportunities and barriers to opportunities and promoters of opportunities, and codified that into 5 basic dimensions. And based on those, Hannah, next slide, please. Based on those, we came up with a methodology, a systematic methodology that asks, that collects a narrative, first of all, from the community and a series of narratives, and those series of narratives then are analyzed collaboratively with the community itself to represent depth into how they're thinking of their community and their worldview in relation to some outcome. And in this case, for this particular slide, we're looking at financial poverty and access to opportunities. What you see here is a web page. This process has been simplified into a usable model that anybody can download and start using as part of it. There's some training that needs to be involved, but otherwise they can do that. Hannah, next slide, please. So the output of this narrative construction, one more slide, please. The output of the narrative construction and the analyses leads to, one more slide. Perfect. So what we saw in the previous 2 slides was basically how the analysis done, rooted in Dr. Williams' work and the barriers to opportunity work. And so those are domains that you want to explore. But once that exploration has happened, what ends up happening is a conceptual model that emerges about the community's perspective about that space itself. So you all heard about systemic factors, right? Systemic discrimination, etc. But the question then becomes, what is the architecture of that systemic discrimination, right? So this slide, this output of that collaborative process is that architecture. So those factors that interrelate to each other to create that system that promotes or inhibits access to opportunities or access to something, that's a set of systemic factors. By the way, when you do this kind of exploration, you find a couple of things. One thing is not just what's around the community, but you also, in this particular project, what we found is there are aspects to a community that they see as disenfranchising them, but those same factors serve to enfranchise and advantage a different community. So there's that interrelationship between factors that serve to advantage and same factors that serve to disadvantage a different community. So I think I'll stop here. There's a deeper dive that we do into the various factors that we have uncovered here, but because this is a broad overview, I think this should be sufficient. Thank you so much.
Thank you so much for joining us. I know our participants are looking forward to live Q&A with you and our other panelists during the Institute in June. Thank you for joining us. For more information on the work of 6 sites expressly serving Africans and African descendants, check out each of our websites and resources.